Well, thank you very much. The title that we saw before is not exactly what I'm going to talk about. I am going to talk about physician response to parents refusing vaccines. I'm going to talk briefly about a study that was conducted and I participated in. The principal investigator in that study, Dr. Erin Flanagan-Kligas, is here with us today, and she's going to participate in the panel that we're going to have. And I'm just going to mention some highlights from that study. So this is a response to Dr. Marcuse. There is a study that has looked at this question of physician refusal. There actually are two, in the sense that the American Academy of Pediatrics does a periodic survey of its members and asks a related question a few years ago. But our study, which was conducted just a few years ago, involved a random sample of American Academy of Pediatrics members, 1,000 of them, or just slightly over. And what was important from that study of those who returned it and who were primary care providers, so we only counted responses from those who actually were in a position to be providing vaccination. So if you were a neonatologist practicing in a tertiary care center and didn't vaccinate children, but you responded to the random survey, that's too bad, but we didn't count those responses. What was important is that 54% of those who responded said that they had encountered refusal to vaccinate in the previous year. What was more important and what we were really most interested in was the issue of how they would respond. And nearly 40% of them said that they would dismiss families who refused to consider all vaccines. 40%. That was pretty surprising to us. Nearly 30% of them said that they would dismiss families from their practices if the parents refused some of the vaccines that are now available. So a very substantial proportion of those responding to the survey and whose responses that we considered to be valid, so primary care physicians, not only had fairly frequently encountered families who said, wait a second, we're not that interested, but had thought seriously about sending those people away, saying, get care elsewhere. What was also important in the survey is that it didn't matter how old the pediatrician was, whether the pediatrician was male or female, how long the pediatrician had been in practice. None of those things were important in their responses. There was, to a certain extent, a difference between those who said they would refuse to continue to care for families with respect to older, better established vaccines, so those that involve DTP, measles, mumps, and rubella, the Haemophilus influenza type B, and the polio vaccines. Now, that means that there is some distinction being made by pediatricians about the value of particular vaccines, whether that's based upon age, that is age that the vaccine has been available, or some judgment that pediatricians are making about the value of particular vaccines against particular disorders. We're not sure. But they do make some distinction between the more well-established, more traditional vaccines and some of the newer vaccines. When asked why pediatricians would dismiss families from their practice, they pointed to a lack of shared values as the main reason to ask families to seek care elsewhere. And I think Doug addressed this in an important way. Prevention and vaccination is the core of current pediatric practice. It's what makes pediatrics, or what has made pediatrics as successful as it has been over the last 50 or 60 years or so. So it's impossible, I think, for pediatricians to think about themselves and their roles in the community and their roles with families without recognizing and considering to be very important this preventive measure that we now have available to us. The other thing that was important in how pediatricians responded with consideration to dismissing was that they said that they were concerned about the lack of trust that patients had in them as healthcare providers. And that was another reason that they would consider sending people away to seek care elsewhere. So we conducted a random survey. We posed questions about what had happened and what people would do in response to situations where parents responded that they didn't want to have vaccines. One can always ask in situations like this, a survey, whether the results of our study accurately reflect the reality out there. It's important to understand that there's no, in a survey like this, there's no way to judge the accuracy of the responses. This is a hypothetical situation. We weren't, after all, observing behavior. We were only collecting information. And we know from social science that there is some distinction between what people say they will do in response to surveys and what they actually do. On the other hand, we know from discussions that we had both before we initiated the survey and from various responses to the publication of this survey that there's a good correlation between anecdotal information about what's happening out there and what people are doing and the kinds of responses that we got. And in fact, our results are similar to the American Academy of Pediatrics periodic survey. We observed a somewhat higher percentage of willingness to dismiss families than in that survey, but it's roughly in the same ballpark. And I think what this reflects, as has been discussed here, is the intensity of the social debate going on now about the importance of this. Having said that, I just want to add the caution that I think is appropriate for any survey-based research, that we may or may not have either overestimated or underestimated what pediatricians are actually doing in their offices. So what's important here? Well, I completely agree with what Doug has already said, that depending on the timing, that is to say, what's going on in the community, is there an epidemic? Is this a college community where many of the students, for religious reasons or other reasons, have not been immunized and are therefore susceptible to measles, and in fact there's a measles outbreak in that community? Or depending on geographic considerations, that is to say, there are, as we saw in the lecture earlier about what's happening here in Washington, there are differences in immunization rates from one area to another. Nevertheless, having said both of those things, the actual risk to most individual children in the United States is pretty small. More importantly, I think, what's driving patients, or parents, as we've heard already in the discussion this morning, is a range of things from the economic considerations to an enormous amount of distortion in the media. There's an awful lot of very sophisticated misinformation out there. If you go to Google and type in vaccine information or anything that involves vaccine, you will be sent to very large numbers of websites that are extremely slick. They're very well put together. Unfortunately, most of the information in them is wrong, but there's very little that an unsophisticated, untrained person can do to tell whether that information that's in those websites is wrong. So there's an awful lot of information out there which misleads people and gives the wrong impression about the scientific and medical information. A recently published paper that I think is really important also suggests another very big issue here, which, though they don't name it so directly, really has to do with the economics of pediatric practice. And they correctly point out that many pediatricians either cannot or will not take the time to address the fears of parents. So I'm just going to read to you a few things from their paper, which is a qualitative study, that is telephone and direct interviews with families who are both acceptors and refusers of vaccines. This was a study out of Yale because I think it illustrates very clearly the kinds of issues and the kinds of experiences that pediatricians are having. This is a quote from one mother. "I went through a dozen doctors who were just being like, well, I won't treat you if you're not going to vaccinate your child." So when parents called pediatricians and either spoke with the pediatricians themselves or their nurses or their office staff, what they got back was dismissal. "We won't take you seriously. We're not interested. You're harming your child or planning to harm your child, so forget it." Another quote. "Because we wanted to find a pediatrician, I called 4 different pediatric groups that were listed in my medical insurance book, and all 4 of them said that they would not see my child. I had nurses on the phone who would normally book appointments. My question was, do you have a pediatrician who would be willing to discuss with us to vaccinate or not to vaccinate?" Note, this is discuss. The response was, she was like, "How could you do that to your child?" So again, dismissal, failure to take seriously the parent's concern. Several non-vaccinating mothers, this is quoting from the article, not a particular individual, distrusted traditional medical care because of negative previous experiences with the medical establishment in general, such as misdiagnoses or poor communication about a diagnosis. As a result of those kinds of experiences, many of the families referred to in this article sought care from homeopaths and naturopaths. And I have to tell you that it's not just non-MDs that we're talking about who are supporting alternatives to vaccination. There is a very large and geographically scattered family practice group in the Chicago area called Home First, where family practitioners, MDs and DOs, board certified in their field, support families who do not wish to vaccinate their children. So it's not just a question of sending them outside the medical care system, it may be sending them to other physicians, licensed as physicians by the state of Illinois in our case, who are willing to support this. A few other things from the article that I think are important. Many of the parents who responded said that the doctors did not have adequate knowledge about vaccines and the doctors did not have time to talk about the vaccines with the families. Many of the mothers distrusted the motives of pediatricians and the medical establishment and explained that vaccination was exclusively for making money for pediatricians and the vaccine industry. In other words, it's not just a question about whether people feel that they're getting good advice based upon science or their perception of science or based upon what medicine does or doesn't have to offer. It's a belief that there is a direct conflict of interest based on economic considerations that some families have about what it means to go to the doctor and be told that you need to have your child vaccinated. They reject this because they think it's simply a money-making ploy for the doctors or for the vaccine manufacturers. So how should pediatricians respond in this way? Well, what I'd like to emphasize is the importance of the doctor-patient relationship. And for me, what that means, as Doug, I think, has already pointed out to us, is that this is, in fact, about a relationship. This is about forming a partnership and making decisions with families that are based upon shared information and a sense of equality in at least the value portion of the decision making, if not knowledge about science or medicine. So from my perspective, and by the way, I want to say with respect to these remarks, this is my perspective and I don't mean to represent this as either Erin's views or Lisa Sharp's views, my co-authors on this paper. We may or may not agree about everything that I'm going to say about this, so it's my perspective. I think it's extremely important in service to the relationship that I think is the core of what we as pediatricians have to offer for people, is the avoidance of preaching and the avoidance of condescension. If you read the Bennett article, what you get from that is the understanding that people don't feel as if they're being treated with respect, don't feel that they're being treated as valued members of a community with some sort of sense of shared decision-making. So it's our responsibility as doctors to foster mutual respect and trust, not simply to demand that people trust in us because we have degrees, because we've gone to residency programs, because we read the scientific literature, but based, again, upon the interpersonal relationship. I think it's extremely important that we understand that there are, in many cases, cultural and value differences. And again, as Doug has said to us, and I agree completely, in the context of a very small risk, that is the case for most of these circumstances, I think we can, by and large, tolerate a great deal of difference based upon culture and value. And perhaps most importantly, though it may be a major issue, I acknowledge this with respect to the economics of one's practice, is for pediatricians to learn to take the time to answer questions, to discuss misunderstandings and misconceptions that families have. So that might mean that instead of scheduling patients every 8 minutes or every 10 minutes, at least in the situation where you have a family who isn't likely to go along or is expressing doubts or concerns about that, that you schedule 20 minutes, that you schedule 30 minutes, that you have families come back to have further discussions about it. Not simply say, oh, well, if you're not going to buy my perspective on this, please go away. Now, again, it seems to me that one of the consequences of the please go away response is that it runs the risk of sending patients away where they don't have access to needed care, especially in emergencies. One of the things I think everybody in this room would like is if their child had an emergency that needed the response of a doctor, they would prefer to have a doctor who knows them and who knows the child and who understands the family's perspective and who can respond with that in mind rather than having to show up in a situation where there is no established relationship. So the business of access to needed care, I think, is very important. And as I've already alluded to, I think it's incumbent upon us to avoid driving families, particularly understanding that we're not talking about adults making decisions for themselves, but children who need our care. We don't want to drive families, therefore children, to substandard care. And I would say that the home first practice in the Chicago area is substandard care, and we don't want to do that. We want those children to come to us for care that we could provide, even if the families aren't willing to accept vaccination, at least at first pass. And again, Doug's already addressed this. I don't have anything new to say about it. I think it's appropriate to intervene with respect to appeals to child protective agencies, that is, public authorities, only when there's an immediate threat to health or safety of the child, a substantial risk of harm, as Doug has said. So what should we be doing? We should be educating families about the health implications for not just their children, but the health implications for other children who are exposed to unvaccinated children. So I think it's perfectly legitimate. In fact, I think it's morally required that when a family says to us, we don't want to vaccinate this child, and that child is going to be in a child care situation, we need to inform those parents that one of the things they're doing is putting other children in that child care situation at risk, whether those are children who are immunocompromised or simply younger and not yet able to have completed a series of vaccinations, say for Haemophilus influenza. It's really important that we carry out our roles as educators, going back to the origins of the notion of what it means to be a doctor, and provide people with information about that. I also think it's important to be flexible, and Doug already pointed out that we can do things like alter the vaccine schedule so that if one of the reasons that parents are concerned about our vaccination policies is they don't want a child to get 4 vaccinations at once, yes, the Academy and the Advisory Committee on Immunization Practices want us to deliver vaccines in a particular way and according to a particular schedule. Nevertheless, I think most of us would agree that vaccinating the child on some schedule is better than not vaccinating the child at all. One of the responses, in fact, the editorial in response to the article that Erin, Lisa, and I published was to say, well, one of the things we can do is to have families sign a piece of paper or a legal waiver saying, we won't hold you, doctor, pediatrician, responsible if something terrible happens as a result of our child not being vaccinated. Seems to me that misses the point. This isn't about being sued or not being sued. This is about what's best for children. And to put it in a legal context this way simply raises the specter of an adversarial situation rather than fostering the kind of relationship that I think we want. So I would say that sort of response, presenting families with waivers, really is the wrong thing to do. And more than anything else, as I think the responses in the Benin article suggest, what we want to do is to avoid abusing our, in many cases, better social and economic situation and simply overpowering people, overwhelming people and saying, you need to do it this way because I know best. So I think it's important for pediatricians to address these issues in a careful, consistent, and yes, time-consuming way in the office, but I also think it's important for pediatricians to engage this debate in public discourse. I think pediatricians should be going to school meetings and discussing the importance of vaccinations. I think pediatricians should be talking on Channel 5 when the opportunity comes up. I think it's important that we carry out our mandate as educators, not just with the individual families that we're engaged with, but with the community as well. So we should take every opportunity to educate the community at large. And very importantly, it's important that we acknowledge conflicts of interest on the part of some individuals and organizations who are, in fact, dependent on manufacturers' largesse. It's not just the fact that some families are worried about financial conflicts of interest. There are real conflicts of interest, and unfortunately, I would have to say that some of them are represented by some of our major professional organizations' dependence on the kinds of donations and flow of economic support that go to those organizations from the manufacturers, whether they're drug manufacturers, vaccine manufacturers, or device manufacturers. I think that conflict of interest issue is a real one, and we shouldn't be running from it. So my perspective on this is dismissing families is drawing a line in the sand, which is simply not appropriate. It's a dysfunctional line in the sand. There are very few situations when we want to be saying, stop, I don't like what you're saying, go away. The fact that we can marshal scientific and medical support for vaccine safety and utility simply misses the point in many cases because it doesn't address the fears and beliefs of many families. And reliance on this business of the integrity of the profession, that is to say, we as pediatricians know, because it's scientifically based, that this is a good thing, ignores the fact that, yes, there are differences among professionals about some of these issues, as illustrated by the home first practice. And when it comes right down to it, there really is no moral gold standard that we can appeal to that says our values are better than others' values. Yes, our science may be better, but our values aren't better. So the line in the sand, the dismissal approach, is not one that I think gets us very far. And in fact, I think there's evidence to say that these heavy-handed solutions that many people want to engage in invite backlash. That is to say, as we say, go away, that, as Doug has pointed to, makes people's positions be more entrenched. When we do this, we undermine trust in the profession, and that doesn't advance the health and welfare of children as a group. Driving children away from our care to care by less qualified individuals puts our patients at risk. And I think the evidence that dismissing families does that is a very grave concern, and we shouldn't buy into that. Thank you very much.